Well, good afternoon. Thank you for participating in the IPN iSmart Overview Training. Today's training will be facilitated by Julie Hibben, Mary Crawford, and myself, Katie B. During the presentation today, we are going to be highlighting some of the key elements of the iSmart system. We're going to be going over what iSmart is, talking about data integrity, IDPH monitoring, one-time and session-based services. Mary Crawford is going to be doing a iSmart walkthrough to navigate through each of the screens to better onboard agencies to the system. Then we are going to talk about potential next steps and then the process for facilitating or directing questions to the department specific to the iSmart system. We wanted to start today's training off talking about iSmart. So the Iowa Services Management and Reporting Tool is known as iSmart. It is the IDPH approved data portal. Agencies are required to enter all prevention data into the system to account for a variety of prevention services that occur over the life of the project period. In the event that your agency needs assistance with iSmart, please contact the iSmart Help Desk. Please note, the phone is an automated system and you will not reach a live person. An iSmart representative will respond to your voicemail in a timely manner. We encourage anyone who calls the numbers provided to leave a message. It is preferred that email is used when reaching the help desk, but all options can be used. When leaving a message with the help desk, we ask that you leave your name, the best number to reach you at, and the best time to be contacted. Just to clarify, this is not the same as the IPN help desk or the Iowa Grants help desk. iSmart does have their own separate help desk to field any questions related to the system.
And now we're going to talk about some data integrity components. Agencies are expected to have a data lead and a data lead backup. And this is to ensure that data are entered on time in accordance with deadlines established within the RFP. The data lead is the individual the department will contact for any data-related questions or concerns. Agencies may have a different process for how data are entered on a monthly basis. However, the data lead will be responsible for making sure the data are entered correctly and on time, even if they have not entered the data themselves. In the event of a staff sickness and/or vacation or medical emergency, whatever the case may be, the agency will still be expected to enter their data on time. Contracted agencies are responsible for entering their data on time within the dates established. And so per the IPN RFP, the data are due on the 15th of the month following services. And please note that this is specific to the 15th calendar day, not business day. iSmart corrections are due on the 15th of the following month. Agencies are responsible for checking the description field to make sure the information aligns with department guidance. The purpose of the description field is to have a better understanding of the services that are taking place. This field should contain a verb or an action word, a sector or who, and a noun, a subject or topic, and consist of 6 to 8 words. For evidence-based programs that are session-based, the description field will need to read implemented EBP. When entering dates, make sure that the plan strategy aligns with the correct Institute of Medicine category. Choosing the wrong category will impact the available fields in the subsequent screens. The iSmart system tracks the number of sessions it takes to implement an evidence-based program to fidelity. Agencies are responsible for providing the number of sessions as intended by the program developer. Once an EBP is nearing completion or completed, contractors will need to verify the correct number of sessions entered into the system. SSRS reports are ran on the 17th of the month. Agencies will be expected to run the reports on a monthly basis to review data that have been entered into the system by program staff. Just to note, these are the current plans for reporting, but final details are still being confirmed. It is important that prevention services that are taking place within the awarded service area align with the work plan that was approved by IDPH. This will make data entry easier as the available options will clearly align with the prevention priority area and activity type. The department will provide data to each IPN-funded contractor each month, and this will include data that needs to be corrected. It is an exception that agencies maintain this information at the agency level. In addition, the department will be providing agencies with a detailed IPN prevention services monitoring report on a quarterly basis. This visual report will outline the number of hours provided under each of the following categories: activity type, county served, and Institute of Medicine categories. This is intended to assist as a monitoring tool for serving the entire service area. Again, these are the current plans which are awaiting final confirmation.
So now we're going to talk about the exception request process. So the department understands that unforeseen circumstances may occur that could impact data entry. In order to account for this, agencies may request an exception request to receive an extension for their data. The following criteria have been established specific to data entry exception requests. All requests must come through the correspondence section of iowogrants.gov. For subcontracted agencies, this request must come through the contract holder. Requests must be submitted at least 5 business days prior to the data needing to be executed. If the request is approved, the department will provide a time frame of when the data must be entered. Agencies will only be granted 1 extension per fiscal year. By having both a primary and secondary data entry staff, your agency should be able to account for circumstances that arise throughout the contract period. In the event of iSmart system upgrades or failure, the department may grant data entry extensions to the affected IPN contractors. The length of the extension will be determined at the time of the occurrence. So we want to draw your attention to the performance measure that is listed in the RFP specific to data collection. So per the RFP, the contractor shall submit accurate, complete, and timely data reporting. The department will deduct a certain amount of funds if the data is late without pre-approval of an acceptable delay, or have severe errors or omissions, or they are not compliant with the deadlines or expectations of the department approved corrective action plan. So now we are going to transition to Mary Crawford, who is going to conduct the live walkthrough of the iSmart system.
Okay, welcome to the iSmart Prevention Intervention Overview portion of this training. I'm going to be covering only the functionality of the Prevention Intervention module, as there is upcoming training scheduled that will cover things like the data field content of our strategy types, activity types, and the Institute of Medicine categories. Just a note that if the screens are not refreshing quickly today, it's likely because of my using Zoom and doing so from a remote location that does not have a fast internet speed. So I apologize in advance if that occurs. I will be using the training site today, so I want to make sure that you're aware if you log into the live iSmart production site, you will not currently see this version. We are finishing testing of our current release for all the iSmart domains, and when that testing is complete, we will promote it to the production site for your use, and we will contact everyone when it's ready. So the prevention intervention module has been available in iSmart Prevention for a long time, but it was used only by our former information library because it only had the capability of capturing one-time strategies and not session-based. For those of you who have been using iSmart Prevention, the biggest changes that you will notice are that this module does not require the creation of a work plan in order to enter services, and it gives users the ability to create group names on their own. So for those of you who have never used iSmart Prevention, I think the functionality is fairly straightforward, but the field terminology may be somewhat confusing. So again, upcoming trainings will address more of the content than today's overview. So now, let's see if I can share the iSmart screen. And if Julie or Katie would let me know if you can see the iSmart training site.
We can.
Okay, great. So I just want to tell you that we are currently on the iSmart training site homepage of iSmart, and because I'm a WITS administrator, I'm going to have more menu options than you may have. So I will just be using the same ones you will need. Just be aware that I do have some more options than you may have in your accountability. So our first step in the process is to click on the agency, and then we're going to look for the prevention link. And for those of you who are familiar with this, you know that we used to have a work plan and strategy implementation links. You will no longer go to those. You'll now be looking for the prevention intervention link. And that brings us to the intervention search screen. Currently, I wouldn't have anything to show you, so I will talk a little bit about the search fields. You'll have quite a few things that you'll be able to search for records using the date ranges. There will be an ID number when the record has been created. You'll be able to search by the strategy types, activity types, a staff, the frequency, and so on. We'll come back to this after I've created some interventions. So our next step will be to create a new one by adding a new intervention. And the very first field that I want to talk about is that the intervention ID number is currently blank and it is not editable by you, and that is because the system will generate a record number after you've completed and saved one. So that will be available after everything has been saved. The next really important field on this screen is the strategy. And the reason it's the most important is it will drive what other types of things are displayed in other fields. So it's really important that when you're choosing this, you know what you're choosing. The main thing is we'll first do a one-time strategy, and that's your one-time events, and they are going to be categorized by our 5 priority in the IPN selections of alcohol and marijuana, prescription medication, problem gambling, and tobacco. So those will be the main categories we're looking for when we're doing one-time strategies, and they are also further differentiated by those Institute of Medicine categories. So you'll want to make sure you pick the one that matches the group that you're working with. And so I'm going to choose the Alcohol Universal Direct today. You'll notice that that system automatically completed that it's a one-time frequency and that it defaults to a one-time session required. That's controlled by our business requirements and our code tables. So the next thing I want to do is go to the activity type, and this list is one of those things determined by what I selected in the strategy. So today I'm going to choose an informational session. I'm going to have a group that's 20 participants or fewer, so I'm going to choose that small informational session. It is not evidence-based, so in the criterion here I will choose none. For the facility, I actually have 3 facilities connected in my little personal Mary's Prevention Agency, so you may only have 1 prevention facility assigned in your agency, or you may have multiple. It kind of depends on how your agency wants to track data. So it's perfectly fine to do either way. Since I have the 3, it defaulted to this one, that's going to keep that one. Then I will next choose the Institute of Medicine classification, and this is important. It needs to match what I chose in the strategy field. So Universal Direct so it matches my strategy. The group name, this is a little departure from what we used to do in the old system, and that was that you just had a one-time group name. It was called one-time group. So now we actually have started using our five SPIF categories, and you'll be choosing one of those to go along with your description of your group. So I'm going to choose implementation today, and then I'm going to say that I presented to a parent group about, and I have to be able to spell, about alcohol misuse. I'm going to date it and say I did it on the 18th. The duration field, I'm going to put in 30 minutes. 30-minute increments are what we have expectation for you to enter here. So 30, 60, 90, 120, so on and so forth. We found a little bug in the system, so it defaults to minutes, but currently it's giving you a required field and a drop-down. Please ignore that. It will be fixed in the future, but as of today, it does have a selection available. So as we move forward, just let it default to the minute, because that's what we'll be using. So again, you'll do the 30, 60, so on to the nearest half or whole hour. We do have a couple of fields that are white, they're not required. There will be a work plan piece of information to enter here. I don't have access to any of that information, so I'm just going to put a 0 in for today's demonstration. The staff field, you will have a list of folks. If you need to do entry for someone else, you can do that here, or pick yourself on that list. For the service population, you will actually be choosing only one, and for this particular one, I've done parent, so I'm going to type in a P, and that's going to take me to parents and families. I'll use the arrow to select it, and that moves it over in the box. If I try to select a second one, then I'm going to see an error message, so just note that you can only do one selection here. Get rid of that. And then if you have a note that you want to add some additional information about your group, you can do that here. Remember, we don't use names, any personal identifiers or initials or anything. But if you have the name of a coalition you want to add here, or maybe you have agency coding that you use, this is the spot to do it in. Then we have to choose our county where the service was provided, and you can't use a letter to type in, but you can do the number if you happen to know which county number you have. So I will just use Polk since I know that number. And again, you cannot choose a second one. You will get another error message. So you'll notice that we now have a required field in our participant demographics. I'm going to say that we had 10. And then as soon as you click out of that, whether it's in the white space or in one of these fields, it's going to activate all of the other required demographic breakdowns. And so at this point, I will type in those, and I'm going to not use the unknown categories. We do expect that you have exact counts for these groups. And then I'm going to make an error on purpose here, so you can see what happens when you do that. So I don't have a note here, and so I'll just type something in, and I'm going to save that. But you're going to notice I still have some red fields showing here, and that tells me that the sum of the race breakdowns is not equal to the total participants. So I need to go in and fix the problem here and save it. And everything looks good. I'm going to finish, and it takes me back to my search screen, and I now have the entry that I just made. So I'm going to give you an example of a couple of more things here just so you get a feel for how this works. I'm going to choose a strategy that has a universal indirect Institute of Medicine category this time, and I'm going to say that I developed some type of written material. This again is not evidence-based. I'm going to match up the universal indirect IOM with my strategy. I could change my facility if I wanted to. The group names, again, your SPIF categories. The description, this time I'm going to say I developed an article for general population about marijuana. And I'll put in my date. You can use the date picker like I have been doing, or you can just type in the date by hand with the slashes. That is perfectly fine. And I'm going to say it took me 120 minutes to do this project. Again, I'm just using 0 for a placeholder. My staff, I'm going to type in with a G. It'll take me to the Gs. I'm just going to put note in there for now. And then we'll type in another county. Now this time I want you to notice that because I chose the universal indirect category, none of these participant demographics are available, and that is fine. In these particular activity types, we do not require any count or estimate because it's pretty difficult to do with some of these materials development. You don't know how many you're reaching, or in an interview, you don't know how many people are listening or anything like that. So we're just having those grayed out. You don't have to do anything further with that. We'll finish. It now is showing again on our list. And then I'm going to add one more intervention quickly here. And we are having a little bit of slowness. There we go. This time I'm going to choose one of the session-based strategies. You'll notice these by their actual names. And something that we're doing a little differently now is that we'll be choosing by grade levels when they're available, depending on which one that you're doing. I'm actually going to choose the life skills for the 12th grade. You'll notice it did switch to session-based, and my sessions required now show the number that we're expecting you to implement. And then one other piece is that the duration is showing just a 0 hours and it's not editable. We'll talk a little bit more about that a little later. The activity type is fairly short, and I'm going to choose educational services. This time I'm choosing a federal registry. It could be one of the other selections other than none. This time for our group name, we're actually going to have a group, and I will show you in a little while how to create those so they show up on the list. So that's in place of those 5 SPIF categories that we had with the one-time strategy. And I'm going to choose this school name that I've created. Again, I want to go and match up my classification with my strategy. And as discussed earlier about the description categories, we want to make sure that they're less than 8 words, or the maximum is 8. And I also want to mention that with the description, I think it was also noted earlier that for our session-based programming that we're going to just put that you implemented. And let me try that again. And EBP, and that's all you need to put in there. And I'll just quickly go through these fields since we've already discussed all of that. High school students, we'll select that. I'll just put in info, click in my participants. I'm going to say that I did 20. I'm going to click in here. And I'm going to save. And I have no date, so it's telling me that I didn't do that. So we will pick a date and save that. Okay, so there's one more step in a session-based strategy, and we're going to click under the administrative actions, this link that says manage sessions. And here's where you're going to add a session to each of your session-based strategy. I'll click the add session link. I'll put in, I have a total number of participants of 20. Session number was already automatically created by the system. And we'll put in the date, and I did 60 minutes. And if you want to put in a comment about the session, you may here, but it is not required. I'm going to save. You'll notice that it now shows on our session that we have that first session listed. And I can click and finish and go back to the main screen, or I can add another session, which I'm going to do right now. And what I want to tell you is I'm going to put in that only 19 participants were there this time. And I'm going to save that. So you'll see the second session has been added. I'm going to finish and return to our profile screen. And this is really important. I want you to notice that this screen did not change. The participant demographics still show 20. So it's going to be your responsibility when you're entering all of these sessions, that when the final session has been implemented and you've met your sessions required, that this be updated to however many participants actually completed the programming. So that's a very important step. It's a little different than our old one. It used to update itself and you didn't have to worry about that, but now it's on your watch to do that. So I'm going to finish that and we'll see that it's there. So if you were to want to go back later and clear this out, and let's say you wanted to search by all of your life skills programming that you know you've done, so you can find this again to add more sessions, you simply put that in your search criteria and up it comes. Now let's say that you decided you wanted to delete that. It was a mistake. You didn't actually implement it. You're going to get an error message that says you cannot do that because there are sessions that are attached. So you would simply go back to the profile, go back to manage sessions, and then you would go in and delete. And it's going to say, are you sure? You'll say yes. And you'll need to do this for both of them, or however many you have. You'll finish, finish. And now when you go back, if you want to delete it, you can. So I'm going to say no. All right, that covers all of the types of strategies. The last thing I want to cover are prevention groups. This is new to the module. You now will be able to create your own prevention groups. You used to have to contact staff to do that at IDPH. You no longer have to do that. So what I have done is already, for the purpose of this overview, is to go ahead and create our SPIF categories. So assessment, capacity, evaluation, implementation, and planning are already here. What I want to make sure that you understand is each agency will need to create these just one time. So I'll ask all the data coordinators to do that. If you need any help, let me know. But I do think it's fairly straightforward. I'll show you how it works. So you only have to do it one time, and you'll never have to enter those again unless we change this field for some reason. But you would actually go in and add your agency prevention group. You would type in the word assessment or any of the other categories. You will choose one time. I'm going to make everything effective January 1st with the start of our IPN. And then you'll want to attach one, or well, actually you should attach all facilities that you plan to do prevention strategies in. And you can do that and move them over, and then you'll just save. I'm not going to do this because I've already created those. The other item you'll need to do then is, and this is for each person entering data, you'll have to create your groups for session-based strategies. I have created 2, and they were in my drop-down then when I went in to do the data entry, but this is where they have to be created first in order for those to show in the drop-down. And so I'm going to just say that maybe I have a third group. I have enough participants. I'm just going to copy this and paste it into the group name because I want to create yet another section that I'm going to do that life skills group for. Just remember, when you're creating your group names, do not use the name of the program. It limits this group then. If I call this life skills, I couldn't use it for any other programming. I want to have a name that describes the group. Please don't call it Mary's group or Linda's group or Debbie's group, because we want to have it specific to the group. It does describe who you are providing the service to. This will be a session-based when you're doing session-based programming. I'm actually, again, going to go back to January 1st. I would ask that at first you only use one facility. I think it could get confusing if you assign different facilities. You could accidentally create sessions in different facilities and not have everything completed in one place. So I would suggest you start with just one. And so if I save that now, I'll have it show up on the screen. At any time, you can reorder things by clicking on the links at the top. This doesn't work quite as well because we do have the mix in between of session and one time. But you can see everything you've created there, and we'll finish. And we'll have to do a little wait. Okay. And then that will just take us back to we can go back to our main screen. And at this point, if I wanted to go in and look at this group again, and I looked at that drop down, I now have a third choice. Okay, so I believe that completes this portion of the overview training for the iSmart Prevention Intervention.
So this concludes our iSmart overview training. And at this time, we will answer any questions that have been included in the chat feature.